Now, if you fractionate the LDL and you have fluffy LDL, a large buoyant particle LDL, it's not oxidized, it's not inflammatory. I mean, who cares? I really don't care about high numbers if they have a non-oxidized, fluffy LDL cholesterol. On the other hand, if they have a lot of small particle LDL and a lot of particles, this is where the lipoprotein profile measures the number of particles. Well, then these particles are more inflammatory, and the more particles you have and the smaller the particles, well, then they can get inside the endothelial membrane of the blood vessel and then cause more inflammation. So in these patients, I would be aggressive in using statins for their anti-inflammatory nature, but only if they had coronary calcification or coronary disease or metabolic syndrome. I still wouldn't be treating small particle LDL in the absence of any documented coronary disease, because I would use niacin, for example. Niacin can change small particle LDL and make it fluffy. Certainly the tocotrienols, I had good luck with delta tocotrienol. That would help. So even nattokinase, I've seen not only thinning the blood, but again, I would see LDL becoming more buoyant. And so I would reserve statin drugs for, again, documented cases of coronary artery disease, and again, particularly males and middle-aged males. And if I did have cholesterol problems or inflammatory cholesterol subtypes, I would try to treat the patient, with weight loss and exercise and nutraceutical support first before I would consider a statin drug. So that's basically what I do.
And I wonder if you could tier your approach with respect to diet, because in my experience, specifically triglycerides, and more generically, anyone who has elevated cholesterol tends to be, in my experience, related to the fact that they're having too many grains and sugars in their diet. And it's not a mystery when fructose is the number one source of calories in the United States. So and then following behind that are the grain carbohydrates. And when has these on a regular basis, there's a tendency to contribute to insulin resistance, which of course will cause the liver to produce more cholesterol and the wrong types of cholesterol, and raise triglycerides and increase to conditions like metabolic syndrome. So I'm wondering what your experience has been in having people integrate these types of approaches and successfully optimizing these ratios and these other cholesterol profile patterns.
Yeah, you're absolutely right. When I wrote this book, Sugar Shock, with Connie Bennett, I really brought to light that sugar is your enemy. It's not your foe. It's your foe and your enemy. Fat is not your enemy, and the problem with saturated fat got a bad rap, particularly in the Eisenhower years and McGovern years. And that's when the corn oil margarine came out, and when that came out a couple of decades ago, we saw an alarming increase in coronary disease because they were trans fats, and coronary disease was really accelerating at a large rate. We all agree that trans fats are horrific. However, saturated fat is very resistant to oxidation. And, eggs got a bad rap because if you ate eggs, they were like pure saturated fat, and they would be turned into cholesterol. And, doctors always felt that, cholesterol was a cause of heart disease because of Ansel Keys and what he did in the 7-country study. And again, it made sense, but the cholesterol was only a hypothesis. It wasn't a fact in causing coronary disease. But sugar is. There's no doubt about it. All the high fructose corn syrup sodas that we're drinking today, all the sugars we're using in the diet, all the cakes, pastries, candies, white flours, etc. You mentioned the grains. When you use an abundance of these foods, you are going to get an insulin response, and you're going to overshoot. And if you look at the most horrific inflammatory hormone, it's insulin. It causes inflammation of the basement membrane of the vessels. It's that one lining of the basement membrane, which is the endothelial cell membrane. And insulin is the most endothelial unfriendly component around. So if you don't want to get inflammation of your coronaries or any blood vessels for that matter, we need to restrict sugar in a diet. And what I would always tell my newsletter subscribers is, never use white sugar, don't drink sodas, be cautious, with ice cream, sherbets, in other words, sweets. Don't make them as part of your daily diet. I mean, even when you and I had dinner together in Chicago, nobody at the table had dessert.
Mm-hmm.
I mean, I always tell friends and family that if they did go out to dinner with me, that we don't order desserts, unless it's a nice healthy dessert. But I think American people in general, we're eating far too much sugar in our diet, and it is inflammatory, and it does lead to coronary disease and metabolic syndrome. So, again, sugar is the enemy, fat's your friend in a way, and especially the monounsaturated fats and the omega-3 fats. They are very friendly to our body. Remember, we don't get an insulin response from monounsaturated fat. That's why olive oil and walnuts and macadamia nuts are so good for you, because you're not going to get an insulin response. And when you don't get an insulin response, basically you're protecting your coronaries as well as you can. So, we're on the same page about sugar, Joe. I can assure you about that.
Well, I thought we were, and so getting down to the specifics of what one can eat in a diet, if one understands and believes this and is seeking to integrate that into their dietary approaches and selections, then that limits the carbohydrates, and really the primary or the more common recommendation is to eat a lot more grains and in their diet than would seem to be reasonable to leading to a healthy approach. So since there's only three primary macronutrients, which is grains, fats, and proteins, if you cut down the grains, you have to increase something else. And for the most part, we don't want to massively increase our protein intake, because that can lead to problems if you have kidney disease. So that means you're going to have to increase your fat. So I just noticed that I have a specific kidney problem too that even requires me to restrict my protein even more. So I'm to the point where I'm eating about 70% of my diet is fat, but it's healthy fat, and it's things like butter and egg yolks and avocados and nuts and seeds. Coconut, absolutely, coconut. Yeah. 4 tablespoons of coconut oil a day. And what I noticed since I've been doing this is that, just as a sort of a comment response to the dessert mentioned, is that really the desire for desserts kind of disappears when you're filled with healthy nutrition. Do you enjoy it? Sure. Could you have it? Fine. But it's not like, you have to exert tremendous amounts of discipline to choose not to eat it. So I think that's an important point to bring up, that as people seek to apply these principles, that once you're getting the nutrients you need, there's not going to be this enormous sense of cravings and feeling deprived that you're really missing something.
Correct. I mean, one thing about fats is when you eat healthy fats, a lot of people feel satisfied. That's why avocado, I think, is one of the best foods you can eat.
Yeah.
I mean, if you look at avocado, it's a monounsaturated fat. You're going to get, like I said before, you're not going to get an insulin response. It's got glutathione in it, vitamin E in it, and also there's this data, I wrote about it in my newsletter, that when you eat avocado, it also allows for greater absorption of other carotenoids, especially lycopene and lutein, so and even beta carotene. So there's something about avocado that really works synergistically with the body, and I included it in one of my top 12 healing foods. Yeah, I love avocados.
I have a whole avocado every morning with 4 egg yolks, and there's a synergy there, of course, with the nutrient absorption that you referred to. But one of the other benefits of an avocado that may not be obvious and that you didn't mention is that it's very high in potassium. And there's a large number of research data suggests that the potassium to sodium ratio may have a very powerful influence on our health, and that, of course, just is easily done by having lots of vegetables. Right.
In fact, I saw that article on the potassium-sodium ratio, and the Harvard alumni showed that, Asherio et al. Showed this about 20 years ago, that Harvard alumni who ate 3,000 to 4,000 milligrams of potassium a day had far lower stroke than their counterparts that only had 2,000 to 3,000 milligrams a day. So if you can get 4 grams of potassium in your diet a day, provided you don't have renal, problems or renal insufficiency, you're going to do yourself a world of good. And that recent article that just came out, I'm talking about it in my next issue of my newsletter. So potassium is a winner. That's why coconut water is going to be king now these days, because coconut water or coconut juice is just loaded with potassium, and it has a very low sodium, and it's a great beverage to take. I mean,
yeah, it's the healthiest alternative to Gatorade that we know, but it still has significant sugar in there. So I guess it's a better alternative to soda, but it really should, in my view, should only be used for someone who's really engaging in a sport or activity where they're having dehydration, where they have to have that fluid replacement and electrolytes, because it is phenomenal. There's nothing that beats it, actually. It really is the king of the fluid electrolyte replacement fluids. So this is great. So now that we've established a dietary approach, what I think the next step is to have your experience with respect to those individuals who, for whatever reason, for the reasons you mentioned, or their specific physician or their own research suggest to them that they're going to benefit from taking a statin. So they're on a statin, and this is a large number of people. It's 25% of the people over 45 in the U.S. So it's millions and millions of people around these drugs. So what can you describe the cautions and the precautions that should be implemented for someone who decides to go on these therapies, and the reasons why?
Sure. I mean, I've been really privy to the side effects of statins for years, and the reason being is I first started using coenzyme Q10 back in 1982. And so I've been using CoQ10 for almost 1981, so it's been 30 years. And when the statins came out in the early 1990s, there was an article by Gironda et al., I think it was 1993, talking about the musculoskeletal side effects of statins with muscle pain, myalgia, weakness, difficulty from getting up from a chair, etc. And they reported that since statins block, several biochemical pathways in the production of cholesterol, in other words, statins are great cholesterol killers, but in the same process, they knock out other biochemical pathways. One of the pathways is squalene, which I think is really essential in preventing breast cancer in women. And the other major pathway is a CoQ10 pathway. So in anybody taking a statin drug, we have to be concerned about immune system dysfunction as a possibility because of the squalene reduction. But more importantly, we have to be concerned about CoQ10 reduction, because CoQ10 is one of the most important nutraceuticals or natural endogenous, like a vitamin-like enzyme that's produced in the body that supports the immune system.